Welcome to Dr. Eye Care. This is Dr. Ankit Barot. I am a consultant ophthalmologist at Vasudhaiva Kutumbakam Eye Hospital, and today I am going to share on what is myopia or short-sightedness. First of all, I will start with definition, then I will go to causes, then I will go to clinical grading, then I will go to clinical types and what you experience, then on to treatment. Starting with definition. When parallel rays coming from infinity are focused in front of the retina and not on the retina, with accommodation being at rest, we call it myopia or short-sightedness. Generally, the parallel rays coming from infinity with accommodation being at rest are focused exactly on retina, neither in front nor behind. In myopia, they are focused in front of the retina. That causes a blurred image. What are the causes of myopia? The causes of myopia are increase in the length of the eyeball, increase in the curvature of cornea or lens, forward placement of lens, increase in the refractive index of lens, also due to cataract. In diabetics with high blood sugar also there is myopia. Excess accommodation also causes myopia. Coming to the clinical grading, it can be graded as mild, moderate, severe. Less than 3 diopters is called mild, -3 to -6 is moderate, greater than -6 is severe. Coming to the clinical types, there are 4 clinical types. One is congenital, second is simple or developmental, third is degenerative or pathological, fourth is acquired. First is congenital. Congenital myopia. Congenital, the word means since birth. This myopia is present since birth, usually on one side, can be on both sides also. It is high, -8 to -10 diopters, but it is constant, is associated with other anomalies of the eye like large cornea, absence of iris, small eyeball, separation of retina, etc. It is usually diagnosed at 2 to 3 years of age, though it is present since birth. Second is simple or developmental myopia, which is the commonest form of myopia. It is present in 20 to 40% of population, normally found between 8 years and 12 years of age of children, so it is called school myopia. Now, what do you experience if you have got school myopia? Number 1, you will have decreased vision for distance. Number 2, you can have frontal headache, frontotemporal headache, watering, fatigue, tiredness, etc. when you have got a small degree of myopia. Also, you may notice that the child will half shut his eyes so as to have a clear vision. Coming to the third type, that is pathological or degenerative myopia. In this, we find in 2% of population this sort of myopia. Now, what the patient experiences in pathological myopia are all the symptoms which are developed in simple myopia, but also night blindness if the refractive error is severe, and also floaters in front of the eye due to liquefaction of jelly of the eye. Coming to fourth, acquired type of myopia. In acquired myopia, the patient can give a history of trauma, of keratitis, of surgery, etc. Now, what is the treatment or what are the complications of myopia? If there is pathological myopia or simple myopia, the retina is stretched. So, even trauma to the eye can cause retinal detachment. So, the patient should take care to avoid trauma to the eye. Coming to treatment, there are 3 basic modes of treatment. One is glasses, second is contact lens, third is surgery, fourth and fifth would be low vision aids and genetic counseling. Number 1, glasses. Glasses are safe, effective and easy method for correcting myopia. Here we use concave lenses or minus lenses. Contact lenses can be used for cosmetic reasons, and if the degree of refractive error is high, they will minimize minification of images and also peripheral distortion. We can use surgery. Surgery, we have got 2 options. One is LASIK and second is ICL. LASIK can be used up to -8 diopters of myopia. If it is greater than -8 diopters, we use ICL. In ICL, an intraocular lens is placed in front of the normal crystalline lens. The third option is low vision aids. If the vision is not correctable by contact lens or glasses, we can use low vision aids in such candidates. We recommend genetic counseling that if two pathological myopes are there, we request them not to get married so that the progeny does not have pathological myopia. I have tried my level best to explain what is myopia and what are the things you experience having myopia or short-sightedness. Even after this, if you have got a query, please post in the comment section below. For more such informative videos, please subscribe to my channel. Thank you for watching.